Earwax affects over 35 million Americans and is the leading cause of conductive hearing loss, yet the procedure to remove it hasn't changed in over 200 years. Our next guest, Sahil Diwan, is revolutionizing ear care as CEO of Softcon Health and creator of OtoSet, the world's first FDA-cleared automated ear cleaning device. What began as a college dorm room experiment to solve his brother's chronic earwax problem has evolved into a viral phenomenon with over 250 million social media views and a network of clinics nationwide. Driven by a vision to become the front door to ear and hearing care, Sahil shares how Softcon is using consumer-style virality to drive clinical adoption and create unprecedented access to care. Join us to discover how this first-generation immigrant is bridging medtech innovation with patient demand. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Hi, Sahil. A big welcome to our podcast. I'm so excited to have you on today.
Thanks for having me, Mike. Excited to be here.
Well, given your incredible journey as a first-generation immigrant who transformed a personal family challenge into a groundbreaking medical solution and your success in building Softcon Health from a college dorm room experiment to creating OtoSet, the world's first FDA-cleared automated ear cleaning device, I'm fired up for our conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Sahil, it's almost time for our community to learn how you and the Softcon Health team are revolutionizing ear care and tackling earwax impaction, which affects over 35 million Americans and is a leading cause of conductive hearing loss, through an innovative automation and viral social media strategy that are driving both clinical adoption and patient awareness. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, it's a good question. And it's something actually I wish someone told me when we were starting out. But find mentors who have done things that you are trying to do. If not exactly the same, then quite similar. It will save you a lot of time and a lot of heartbreak by finding people who've done it before.
Love it. Sage advice, Sahil. And of course, we're going to discuss this on the other side of the commercial break and hear about the journey of you launching this company, as I kind of teed it up on the front end here. But this is really you as an entrepreneur in your first foray into healthcare. I got to imagine finding those mentors and advisors to help you navigate one of the most complex industries, healthcare, right? As a multi-sided, kind of marketplace, if you will. How valuable have those mentors and advisors been to your own personal journey and the journey that you have been on with your startup?
Yeah. So again, this is something I wish I did more of when we were getting started. But yes, we're in healthcare. And then on top of that, we're a medical device. So obviously a highly regulated industry. We went through some great accelerator programs when we first started fundraising, and that unlocked a lot of connections for us. But again, finding the people who've done it before will save you a lot of time, a lot of stress, and a lot of money as you dive deep into the details and build the company.
Couldn't agree more. I still leverage my mentors and advisors throughout, kind of my journey in healthcare as we continue to work together to move this industry forward. So I know exactly what you mean. Sage advice, very, very important. It doesn't matter who you are, whether you're, a healthcare administrator or if you're an entrepreneur or if you're even an executive at a large co. I think having these mentors and advisors to lean upon, especially as, we're all of us that are working at the intersection of healthcare and innovation, very challenging problem sets that we're working with here to move this industry forward. Those mentors and advisors can be absolutely invaluable. And I'm sure they have been, as you just mentioned, to your company, Softcon Health. And speaking of, on the other side of our commercial break, we're going to dive into your wonderful journey with your organization and the incredible impact you guys are having across the country. We're going to discuss all of that and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow. All right, we are back with Sahil Diwan, CEO of SoftCon Health, the creators of OtoSet. Sahil, thank you so much for teeing it up on the front end. The importance of those mentors, the importance of those advisors to build companies of lasting impact in healthcare. Important to have those folks as we continue to work together to move our industry forward. Of course, Sahil, we have a lot to discuss today. You guys have been on quite the journey with your organization at SoftCon Health. And as we mentioned earlier, the creators of OtoSet, a lot to discuss. You're now over 7 years into this journey. Just to get past year 1 and 2, as you know, as a startup is one heck of a feat, but to be now over 7 years in, incredible. Can't wait to hear what was the journey like of even starting a company like this? What were those aha moments? What were those whys? I know it was actually personal for you, so we'll discuss that as well. A little bit of a family affair. And then, of course, got to ask, hey, how's it going today? What are you guys experiencing in the marketplace? What are the things that you're learning from your end users? How is it going today in the marketplace? And then from there, got to look a little into the crystal ball. What are you seeing on the horizon? As you know, innovation and technology is moving very fast within the healthcare industry. So what should we be as listeners to the podcast? What should we be contemplating over the next number of years? Not only kind of the industry at large in the area that you guys serve, but of course, your journey as an organization and the products that you're bringing to market. Then, of course, we can't let you out of here until we figure out ways to help you and your team out. But of course, before we go and unpack all of that, Sahil, take us behind the scenes, pull the curtain back, share with us, how did this company begin in the first place? Teed it up on the front end in the dorm room at University of Oregon, Eugene, Oregon, an incredible place, one heck of a school and one heck of a football program that we talked about before hitting record. How did this all come together? What was the aha moments? And most importantly, what is the why behind all of this?
Yeah, so we'll actually start there when I was in college. So I'm a software engineer. I studied computer science at the University of Oregon. And growing up, I just always had an itch for wanting to build stuff and kind of go the startup route. Is not always as sexy as it seems now actually doing it, but it's a really fun experience. So yeah, the University of Oregon, what I first ended up doing was building apps and getting a lot of consumers using these apps with some friends at that time. After I graduated college, my brother, the story of OtoSet and SoftCon Health really starts with my brother. He's a biomedical engineer today, but growing up, he just had this problem where you'd have to go into primary care and sometimes he'd be referred out to ENT. Every few months, he'd have to go and get his ears cleaned out. It all kind of started where one morning he wakes up and he can't really hear out of one of his ears. He's pretty young at that point. So my mom's concerned. We go to our primary care doctor and, a lot of people actually listening to this might really resonate with this experience. They say, don't worry, you're not losing your hearing. You just have a lot of earwax buildup. And at the time, we just kind of thought he was this unique kid with this unique problem. And as we started looking into this in much more detail, we realized how big of an issue this problem of earwax buildup is for people. So it's a problem that affects 1 in 10 children, 1 in 20 healthy adults, and 1 in 3 people over the age of 65, which translates to about 35 to 40 million Americans, and worldwide about 800 million people. So a very common issue. And I think that explains a lot of the virality we've had around our product that we'll talk about. But again, starts with my brother having to go in regularly for an ear cleaning. Anyone who's had it done before, it is kind of a medieval experience getting your ears cleaned. They use a, what's called an ear and bladder syringe, which is really a repurposed bladder syringe and a kidney basin on your shoulder, and they just go at it. Or you're referred out to an ENT surgeon and they'll go in with a microscope and microsuction and remove that impaction. It is immediate relief from whatever your symptoms are. For example, temporary hearing loss, fullness in the ear, pain, discomfort. So it is a very satisfying procedure to get done. And the patients that we serve, get that experience right away. But it's just an annoying issue and it's a recurring issue for so many people. And so when my brother grew up and became a biomedical engineer, he wanted to create something to solve his own problem. And that's how the idea of Otoset came to be. The idea was pretty straightforward. Let's combine the two most popular methods of treatment, which is irrigation, so that water being used to remove wax and flush out wax from your ear canal, with what the ENT is doing with microsuction. So build those into a device together. For anyone who might not know what our device looks like, it actually kind of looks like a big version of Beats by Dre, like a cool looking headphone. And that's obviously, again, a first of its kind because you can now clean both ears at the same time. So it really reduces procedure time. And the big thing that Otoset does on top of that is that it creates a consistent experience for patients, because the results and the experience you typically have for a procedure like this is really going to vary on the clinician that you get and the level of experience that they have and how frustrated and stressed out they might be that day. So going back, we first started developing this while my brother was actually still in college, and in the college dorm room, we were 3D printing prototypes. That's how we first got it started with my brother and our engineering team. And at that time, I kind of was like, had a cot in the closet that I would sleep in when I was visiting for us to do the prototypes. And yeah, it's just a crazy way to start a medical device company. It's not the traditional way to start a medical device company. But as you mentioned, this all came to be from a personal problem that my brother had. And when we first started thinking like, should we do this? It sounds kind of crazy to build something and be in the earwax business. We just reached out to a lot of physicians. Like that was how we validated this to begin with. We reached out to a lot of physicians. I actually built some like automated stuff so I could just reach out to hundreds of physicians and thousands of physicians on LinkedIn. And we had a really high response rate from just cold outreach. And I think that told us a lot to begin with. We basically pitched like, hey, here's this rendering of this device. If we build this and it works like we say it's going to work, do you think this is something that should exist? And they said, absolutely, this is such a big problem. And, particularly with ENTs who we have as advisors and investors, this is one of the highest volume procedures they perform, which is crazy. ENTs didn't become surgeons to remove a bunch of earwax. So this is not something they should be spending a lot of time with, and not something healthcare systems should be being bogged down with.
Wow, what a powerful founder story. I love it. Sleeping in a cot in a closet to make room to make the prototypes. That's what it's all about. I absolutely love it. Sahil, let's talk about a little bit around the technology itself. In preparing for our conversation today, I noticed that the product Otoset combines irrigation and microsuction technology, as we mentioned earlier, in the first automated FDA-cleared ear cleaning device. So the question from that is, why and what makes this approach revolutionary compared to, say, some of those traditional methods, those traditional manual methods that you just mentioned earlier, that clinicians have been using for decades? Why is this so revolutionary?
Yeah, I mean, again, the ear cleaning procedure fundamentally has not changed for over 200 years when an otologist decided to use a bladder syringe to clean people's ears. I'd say the biggest difference is the automated part, and then the fact that we're combining the two main methods of the treatment, so irrigation with microsuction combined, along with the automated part. The automated part is particularly important because you are now standardizing best practices for the treatment. This is not the simplest procedure to perform. And again, it comes down in the more traditional setting to the skill level that the clinician has and the experience that they have with this. Your ears are delicate. Things can go wrong pretty easily if the clinician's not very experienced with performing a manual removal. So Otoset provides, the best practices every time. So irrigation is directed towards the walls of the canal, never at the eardrum, for example. The pressure is always consistent. And then microsuction is being incorporated to not just flush out the wax, but actually pull it out along with all that waste into a disposable waste container. And our ear tip is actually disposable too, which is also maybe another interesting fact is the device also provides a much more hygienic experience, whereas the tools used today, like the syringes and spray bottles and kidney basins, are not a great experience for the patient or the provider.
And let's stay on the topic about the product. I came from the medical device industry, so I know getting an FDA clearance for a novel medical device is notoriously difficult and challenging. What was this journey like for you and the team in regards to getting that clearance? And how did you balance innovation with the rigorous safety and efficacy requirements needed for clinical use?
Yeah, so we were a class 1 510K device, so not the most complicated pathway, but we still needed to do clinical trials and all the testing that's involved with the 510K. And this was our first really big learning curve, and where I think having some advisors and mentors a little bit earlier would have been also very helpful. But where things changed for us as we started to prepare for FDA 510K submission was really when we did this program that's part of Texas Medical Center. They have an innovation program there for health tech companies and medical device companies. And through that network, we met our regulatory consultant who we've used to this day. And she really walked us through all the steps and what a 510K is, what needs to go into it, the testing that you have to do, who you might want to do the testing with. There's just so much that goes into that process. Looking back at it now, it's not as bad as it felt at the time. It's just a huge learning curve. And having people who've done it hundreds of times before will really de-risk a lot of your process and save you a lot of time and money because you won't be, messing around doing the wrong things. So I would say going through the regulatory process is probably one of the most important times to have someone who's done this over and over.
And of course, got to flag and bring back what you discussed on the front end of the podcast, leveraging those mentors, leveraging those advisors to help you through that journey, right? Incredibly and critically important. The folks down at the TMC and Texas Medical Center with their innovation hub is just exceptional, one of the best in the industry for sure. So it's phenomenal. They do exceptional work down there. So of course, I'm personally extremely excited to talk about kind of your guys' social media strategy and the kind of the viral success you've had. But before we go there, let's also maybe just talk a little bit more around the business model and kind of the clinical adoption, right? Which is so incredibly important to all of this. And one of the biggest challenges in medical device and med tech is ensuring that clinical adoption leads to this kind of consistent product use with those end users. How are you tackling this challenge? And what does your guys' go-to-market strategy look like for getting Otoset into more clinics across the nation?
Yeah, social media is a big part of our story, and I think it's quite unique to us as a medical device company and what we're doing there. Before we even started doing anything on social media, it was first very cold outreach and going to conferences and talking to clinicians. That's how we did our initial soft launch. So after we got FDA clearance, the first thing we started to do is we actually at that time had built up a wait list of clinicians, a lot of them from cold outreach, many of them who we'd met along the way at conferences and whatnot. And we then did an initial soft launch with the first version of the device, and we learned a lot. We learned a lot in those settings and in those initial clinics on how to build a more robust and more reliable device. That was a lot of what the upgrades that Otoset have gotten over time have been focused on. We learned, obviously, as we had a higher and higher patient volume that we were treating, some updates we could make to the design of the device to fit patients' heads better, to fit their ear canals better. That was also a lot of the learnings that were incorporated into Otoset, which is now on its third version of the device. The initial launch was very focused on product feedback. And one of the things I was a bit more surprised about, maybe I shouldn't have been, is just more, again, being more naive and not having great mentors at the time, was training. Training, even though the device is quite straightforward, building out a training program for clinicians around this was something we did not think enough about. So our training was pretty straightforward on just Otoset, like how to put it on a patient and run it. What we did not expect having to do at the beginning was like teaching clinicians the right way and the right things to do. For example, to soften the earwax if it needs to be done ahead of time. To teach them also, sometimes you might need to use a manual tool like a curette to finish the job after you run Otoset. So those were things we had to teach in our training program, and we had to build out that we didn't initially have at our soft launch. So I would say that was probably one of the more surprising things going through that process. And then you have this next challenge of utilization. And this is not, this is a normal thing in medical device of a lot of, for us, it wasn't particularly hard selling into these clinics. We got into hundreds of clinics very quickly. The next challenge after you kind of get through products updates and training updates is, yes, in many of these clinics, it'll end up being an expensive paperweight. And that's just the reality for a lot of medical devices. And how do you increase utilization? And a lot of the times clinicians will buy the device and then hope to work it into their workflow. They're super busy, or they might be buying the device hoping that some of their staff will use the device. And, maybe they're not so incentivized or so interested in doing so. And this is around the time where we started to incorporate social media and see a lot of patient demand. And I do think, what would we have done at that point if we didn't have such high patient demand to drive utilization? But what started to happen was that some of our best clinics would actually post videos, and these are not marketers at all. Like they have very small social media accounts. They might be in smaller cities, and they would post videos of them treating patients with Otoset on social media. And for those of you who haven't seen our videos, you can go to otoset.com or type in Otoset on any social media channel and you'll find it. But they're pretty eye-catching because you have these clear containers. One of them is clean water, and the bottom container, which is separate and disposable, is the dirty water and where the earwax comes out. And the funny thing is, when we had our first prototypes, we actually made those containers not clear. And then some of the feedback from clinicians was, make it clear because I want to be able to see how the procedure is doing and what's coming out and if I need to run it again. So it wasn't about the social media aspect at that time. But when clinicians would start posting these videos, the grossness factor, a little bit of like that crazy, like, what is this? How does this work? This is a problem that I have, starts to kick in. And these videos that they were posting would get millions, if not tens of millions of views. Again, these are small channels with very little following. And at that point, we're like, okay, there's obviously patient demand here, and that can help solve some of our utilization challenges. So what we started to see just from that, and these were separate, they were posting on their own accounts. We were not active on social media on our own accounts yet. And most medical device companies aren't. They don't do much marketing in general, right? Or direct to patient marketing, I mean. And so what we started to see was a lot of patients coming to us asking like, hey, where is a clinic that I could go to near me to see if I have this problem and get my ears cleaned if I need it. And we had not really built out like a partner network to refer these patients somewhere. So we started to work on that. And as we worked on that, we were starting to post on our own social media accounts. For example, like over the last year and a half, we've collected about 1 billion views across social media on our accounts and other accounts sharing our content. So that's just a huge amount of awareness now, not only for our product, but the problem and for ear and hearing care in general. People are asking when they see our videos, is this a problem that I have? Is this the reason I might have hearing loss? Is this the reason I might have fullness in my ear? So they're not just wanting to experience the product. They want to get whatever problem they have solved. So now we had this program where we were driving patients to clinics that were nearby them, but we kind of hit this next wall. And it was finally one of those really good problems is how I like to describe it. You now have so much patient demand that the clinics actually can't even serve it. So, for example, a clinic that we work with might be able to see 30 new patients in a month, but we have so much demand that you can see 30 patients in a day. So we wanted to figure out a way of how could we serve that patient demand directly, because the system just wasn't set up for, and these clinics aren't set up for just cleaning patients' ears all day and checking their hearing and all that, right? So we actually were kind of forced into this model of, can we put our own clinician, our own nurse in a medical space and have patients book directly from our website and be served by clinicians on our staff. So we started doing that earlier this year and it worked. So now what we're starting to do, and I mentioned this at the beginning of our call, we just opened a location in Denver, but now the beginning of this year in April, we started 2 locations. We're about to be 10 locations pretty soon. So we're opening a new location every 2 to 3 weeks right now. So we expect to be in the majority of major metros by the end of next year. And we're seeing, we've already seen thousands of patients come through our clinics in such a short amount of time. And these patients are coming in for appointments that they're paying out of pocket for. So I think that's something we can definitely talk about and what we've seen there. But the experience is they get their ears checked by our nurse. They can talk about whatever problems they might be experiencing. They then obviously get their ears cleaned with Otoset. And then we actually check the majority of patients' hearing afterwards. We provide a hearing screener on an iPad. It takes about 5 to 10 minutes. And I think that's a really important part of what we're doing now as we become what we call the front door to ear and hearing care. Because many of the patients that come to us want to find out if some of the hearing loss they have is due to earwax buildup. In many cases, it can be. But in also a lot of cases, they really do have hearing loss. So we can now help these patients years, if not decades, before they might show up to a normal audiology clinic. We can help them find out about what their problem is and, solve that problem much sooner than the traditional methods. So we do really think that we're becoming this front door to ear and hearing care, creating accessibility for this category. And it's such a surprising, we are fundamentally creating this category, and it's such a surprising amount of demand that we're seeing.
So cool. So welcome to Denver, my friend, by the way. It's great to have you in the community. I might have to take a pit stop and take a look myself. That would be a lot of fun. Well, that's an exciting growth trajectory and the way you guys have done it. Like we said earlier, it's very atypical of a device company to have that virality in the kind of the social media world. Absolutely incredible. So as we now look a little forward as well, grab a little bit of that crystal ball off the shelf, if you will, Sahil, let's kind of look a little kind of future vision and kind of where things are heading. You guys obviously have your venture funding and you're being recognized as, one of Fast Company's best health designs of 2023, just a short time ago. And so with that being recognized now on that national stage and the significant growth that you're experiencing, what's your team's long-term vision for how SoftCon Health will continue bridging this gap between med tech innovation and patient access, right? You mentioned it a couple of times. I love this kind of this front door concept. Where do you see ear care heading in the next, say, 5 to 10 years? And where does your company belong in that?
Yeah, our primary focus right now is serving patient demand. We need more locations across the country for people to be able to go to get easy access to ear and hearing care. So our focus right now is growth of this model. So going from the 10 locations we have today to 50 by the end of next year and hopefully many more soon after that. So that is focus number one. Obviously, beyond that, we actually do have a direct-to-consumer version, more of a preventative version of the device to be in development. It's late-stage development right now. So many of the patients who come in need ongoing professional care, and a lot of them just wanted to find out what if they had the problem, and they don't need that ongoing professional care. Think of, people who really have the problem having to come in regularly for like a dental cleaning. That's kind of a similar way to describe that. So we're looking at more ways to create access to care for ear care and more awareness for ear care. At this point, with the amount of following that we have, we've already become a pretty significant brand and building up this category. So I think it's growth of our network, serving patient care, and also potentially launching our own consumer version to better serve the patient demand.
Very exciting and near and long-term future for the organization. But of course, now let's bring it back to current state. Sahil, as I mentioned, as we're getting ready to record this podcast, we have one heck of a community rallied around the show and have done wonderful things for many of our guests in regards to helping and continuing to be of assistance where they can to move organizations and visions just like yours forward. So with that, what's one problem, need, or question that you and the team have that our community can be helping you with?
Yeah, I think one thing we're particularly interested in this and what we're being pulled really into is this consumerization of healthcare. And what I'm looking for are always great marketers who understand what we're doing, who may not actually be from the medical device industry, might be from other industries, and could bring some of their learnings into our industry. So if anyone's listening here and you're a great marketer, definitely reach out to me. I'd love to connect with you. And then also, of course, as we build this brand, which most medical device companies don't really have, right? So we're building this brand now. I'm very interested in connecting with not just marketers, but investors in the consumer space. Most of our investors are traditional medical device investors. I do think now with the pull that we have from patients and consumers that we do need some more experience from consumer investors.
Well, for the folks that want to kind of connect with you and discuss some of those things that you just mentioned, how do they get a hold of you? Social media handles, contact points online, websites, or otherwise? Obviously, they can go and just search the organization and probably see all these viral videos of themselves. But where do you want to point our audience to get a hold of you?
Yeah, if you're interested in learning more about Otoset or wanting to get your ears cleaned yourself, check us out. Type in Otoset, OTOSET on any social media channel or go to otoset.com. And then if you'd like to reach out to me directly, you can do so on LinkedIn by searching my name, or my email is sahil@softconhealth.com.
Easy enough. And for our community tuning in, just simply scroll on down into the episode notes where you're accessing this episode in your podcast player, or you can head over to our free global online community at passionatepioneers.com. There will be a post for Sahil's episode where you can leave any comments, suggestions, feedback, or otherwise, and get those contact points that Sahil just listed out, again, over at passionatepioneers.com. Sahil, what a wonderful discussion today. A lot of fun. Just an absolute joy to be with you, to hear the journey, where you guys have been, where are things today, and of course, most importantly, where you're going to be heading tomorrow. Wishing you guys nothing but the absolute best. But of course, before we let you guys out of here, have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
we want to create greater access to care.
Excellent. Well, again, we know how busy you are, and thank you so much for taking the time to be with our community today to share everything happening in SoftCon Health and with your product and the creators of Otoset. We appreciate your time, Sahil. Wishing you nothing but the best. But again, thank you for being with our community today.
Thank you, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.